Yeah, you're welcome.
Thank you.
It simulates the actual arteries that are in the heart. So currently no other machine can test how your blood clots given the conditions of the actual heart. And then it also checks the effectiveness of drugs working to prevent clots. So how it works is you take 15 milliliters of the patient's blood, you put it in this syringe, and this whole thing comes in a little pack right here. So this includes a chip, a syringe to put the blood in, and an exit bag. So the lab practitioner or the nurse would take the syringe, place it in this adjuster, this pressure monitor, take the bag and slide it down into this hole. Take the chip, slide it underneath the light source and the photoreceptors. And this clip holds it into this corner to make sure that the sensors, the channels, and the light are all perfectly aligned to make sure we get the most accurate reading. So then, as you can see, the blood will start to flow through the tubes, through the chip, and then out through the exit tubes into the exit bag. And each one of these tubes represents a different artery in the heart. So our actual machine, when we go to run the test, will turn it on and bring you to this screen. You can select the amount of time you want the test to run. So it's run for 1 minute right now. So what will happen is the lasers will come on as the blood's flowing through, and they'll start to detect the amount of clotting. And now this test takes 15 minutes, so over the course of 15 minutes, the clot will gradually build up. More light will pass through the clot since clots are more clear than full blood. So our little photoreceptors underneath here will pick up that change in light. Now our little pressure monitoring system, this keeps our blood pressure down here at 0.2 psi, which is what we need to make sure the test is valid. So what it will do is it holds the blood level at a certain height, and that generates a certain gravity pressure on the blood down here. So to keep it at that level, we have this device here which slowly raises the syringe to keep the blood line at that level as the blood drains out. So when it gets to the actual blood level, it'll stop and hold until more blood drains out. So what's going on down here is all the channels are sensing the different light output. So see how it has stopped to wait for blood to drain out. So the test is now done. This will reset. We'll go down to prepare for the next syringe or the next test. It prints off a little receipt that the nurse can take to the doctor with the clotting times on it for each channel. And using these clot times, the doctor can, through the characterization of patients through our preclinical trials, will be able to tell what risk level they may be at for heart attack or blood clotting, and also a certain prescription for that certain individual, because too much Plavix will cause the blood to thin too much. It'll cause internal bleeding and you'll have organ failure. Too little, you can still have a heart attack. So this machine will accurately tell you how much Plavix that individual needs in order to suit their needs the best to make sure the medication is working to its fullest. Also on here, you can see a graph of the clotting percentage per time. So this is useful in the characterization so that you can see how the slope of the data is to see how quickly the blood clots. And once it reaches a certain threshold, we know that that channel has clotted, and it'll stop the time for that channel only and record it. So as each channel clots, it'll record a different time. So then once the test is done, you just hit reset. It'll take you back to the test start screen. And to get rid of the device, when we talked to all the nurses and doctors at hospitals, they said they wanted one thing they can slide in, one thing they can slide out, and then throw away. So once the test is done, you lift up the exit bag, which is kind of overfilled when you run too many tests. We'll place this cap back onto this to seal the blood bag, so blood won't spill everywhere when you take it out. So move the chip out first. Lift out the blood bag. Lift out the syringe, which will be empty by this point in time, and then you can throw all of this into the hazardous waste and the machine is now ready for the next test. So you would put the new syringe, the new chip, the new test bag in, close the lid, hit go, and it's ready to go for the next test.
Wow. Amazing.
So,